We are the Regional Resource Centre for the Kimberley region and act as a hub, I suppose, for the region for people out and about that might need a higher level of care. Here at the hospital, we've got a lot of different departments. So starting with outpatients, we've got the emergency department and an emergency short stay unit. We have a 4-bed high dependency unit, general ward with 25 beds. We've got maternity, a special care nursery, paediatric ward, and also our Margulian, which is our adult psychiatric unit. So they're all services that are placed within the hospital.
We only have 2 theatres at Broome, so we have usually one elective list going in one theatre and the other is reserved for emergencies. You get a lot more opportunity for exposure to all the different specialties. So you tend to become a bit of a jack of all trades up here. So there's much more opportunity to get into all the different specialties and all the different areas of theatre when you're working in a regional hospital. You know, we try to support people and upskilling them into other areas. In the city, they might have anaesthetic technicians. In public hospitals, we have nurses. Our clinical nurses have collectively got quite a lot of experience behind them, but we also have registered nurses on the floor that have a lot of experience as well. So we have general surgeons based here, we have gynecology obstetric surgeons based here, and we also now have ophthalmology consultants based here. Now the visiting specialists are ENT, orthopaedics, vascular, urology, and then we also do some dental lists. Up here my kids do music lessons, they do sports, they can see their friends, all their friends are so close. I don't have to drive for longer than 10 minutes to get anywhere. And when my kids are sick, I can just jump and go and they're close. You know, if I was in the city, I'd be working 9-10 hour shifts. You know, I wouldn't be seeing much of my kids. They wouldn't have the opportunity to do all of this. Being part of that small community where everybody knows each other, it's going to Woolies at the end of your shift and say hi to 5 different people that you know, rather than being completely anonymous. You are never going to be disadvantaged by working in a rural, remote area as a theatre nurse. The experience of working with the types of emergencies that we encounter, the types of situations that we come across, purely because of the distances that we have to deal with. To get that experience of actually being at the forefront of that and getting those people down to Perth in those situations if we can't deal with it ourselves, that's an experience you can't get unless you're here, unless you're in it.